Hi, my name is Dr. Mary Hinckley, and I'm a reproductive endocrinologist and infertility specialist practicing in the Bay Area of California. I grew up in Nashville, Tennessee, and came out to Stanford University for my undergraduate education. I then went back to Nashville to Vanderbilt University of Medical School for my medical training. Then, once I knew I wanted to be an OBGYN and specialize in infertility, I came back out to Stanford University where I did my OBGYN residency and my fellowship in reproductive endocrinology and infertility. Now I have my own practice over in the East Bay, Reproductive Science Center, with 6 other physicians where we take care of patients to provide them the best chances for having a family. And I'm here today to talk to you about when is the best time or the right time to do IVF. And I get asked this question all the time, whether it's from patients that have finally come to my office to see me, or whether it's from people at a party or the parents of people at a party who want to know when is the right time to do IVF. And the question, I think, comes from the fact that people see IVF as a last resort. Nobody wants to do it. They've heard horror stories about how painful it is and all the shots. On Instagram, there's pictures of each needle lined up. The medicines sound crazy and make you irrational. And people have heard about risks and problems and things that have gone wrong. But the truth is, IVF is not that way anymore. And it really shouldn't be a last resort. So I'm here today to talk to you a little bit about some of the improvements and how IVF can actually help you get to your goals sooner. So, let me tell you about the things that would make someone want to do IVF sooner. Those are patients that are interested in having a family, interested maybe in having a larger family, 2 or 3 children, but maybe are a little late to the game in starting, or patients that are having trouble conceiving and have had the basic things ruled out. If you've already made sure that you're ovulating, you've made sure that your tubes are open, you've made sure that there's sperm, and you're still not getting pregnant, then it's time to talk to someone like me about IVF. In addition, if you don't have a partner, but you still want a family, or you're facing a medical disease like endometriosis or even cancer, now's the right time to talk to me. Now, IVF can be broken into a couple phases, and those phases can help make IVF much simpler and not nearly the overwhelming process it used to be. Phase 1 is the egg retrieval. And this works if you're a single woman wanting to freeze her eggs, or if you're a couple not yet ready to get pregnant, or if you really want to be pregnant right now and need to start the IVF process to be pregnant as soon as possible. So that egg retrieval process is broken into 2 parts. Fertility pills that you take first, usually estrogen or estrogen and progesterone, much like birth control, and then fertility shots. Now, these are little tiny needles that go in your stomach. They're not super painful, but it is a little scary to do shots if you've never done them before. Maybe just because the medicine is really expensive and you're afraid that something must go wrong or could go wrong. But in general, it won't, and we'll teach you very well how to do those. You do the shots for 2 weeks, and then at the end of the 2 weeks, you have what's known as an egg retrieval. This is a simple process. It's outpatient surgery where you get medicine and you're asleep. You won't remember anything or feel anything, and it takes about 20 minutes. We go through the vagina with a needle and an ultrasound, and so there's no cuts or incisions. And then we put the needle in each ovary, the right and the left, assuming you have 2, and we take the eggs out. There's an embryologist there by the bed to identify the eggs immediately after we've taken them out and get them ready for whatever the next step is. You then wake up from anesthesia, and typically patients will say, "Are you already finished?" They might need Tylenol or Advil, and even a few might need something stronger that night at home. But the risks of the procedure are very minimal. Now, that day before you go home, we tell you how many eggs, and most people are back to work the next day. That's especially with the protocols we use at my center, because we've found a simpler, easier way to do IVF. And that's including a medicine called Lupron, the Lupron trigger. This allows the ovaries to shrink back very quickly after the egg retrieval, so that they don't have pain and bloating and all of the things you might have heard about in the older way IVF was done. Then, if you're actually making embryos, the next day we'll call you and let you know how many fertilized. We'll use sperm that your partner has provided or a sperm donor, and we'll put a sperm into each egg or drop a drop of about 50,000 sperm on top and let the best one win. That day that we call you to give you the fertilization report, we tell you how many of your good eggs have made embryos. And typically it's about 75 to 80%. Not every egg is healthy and not every sperm. But the good ones will make it, and we continue to culture them for about 5 to 6 days until they reach the blastocyst stage. At that stage, we know we have a healthier embryo that has more potential to become a baby. Many people choose to test the embryos at this stage to make sure that they're healthy and free of any chromosomal problems. But that's not necessary. And when you get to talk to your reproductive endocrinologist, they can help you decide what's best for you. So that's the first phase. Then you're finished. If you're ready to get pregnant, or if you're going to take a break for a while, you can then decide whether you want to go into the next phase, phase 2, which is the embryo transfer. This phase typically takes a month, and there's different protocols that can be chosen depending on what values you have in terms of how much medicine, how many shots, and then we'll help you choose a protocol for putting the very best embryo back. At Reproductive Science Center, we only transfer one embryo back at a time in almost every case, and that's because the success rates are very good, and we know that twins and triplets can be more risky. So we want you to be pregnant with one healthy baby at a time. And knowing that you might have extra embryos in the freezer can make you not so worried about whether you're really going to be able to have 2 or 3 children. So we'll put that one best embryo back, and typically 68% of the time, if the embryo's been tested, it will work and you will have a baby. You may still be on medicines for about another month, but in general, most people can tolerate this very well, especially when they know that a baby's growing inside them, soon to be born. So that's IVF. It's pretty simple. So if it's not so horrible, then what are you waiting for? A lot of people will choose to do it sooner. Now, there are still some people that are worried about the technology or maybe worried about the babies and the outcomes. But we're starting to see so much great data. IVF is about 42 years old now. And so the data that we're getting shows that babies are born healthy, free of disease in many instances, and grow up to have good, healthy lives. We're even getting SAT scores and ACT scores on these babies now and finding out that they're quite smart, just like their parents. So there's less to be afraid of in terms of the process. There's more that you can do while you're going through IVF, like work or do exercise. And there's a greater benefit at the end to having a healthy baby. So I think as people become more aware of this message, they're more likely to pursue IVF sooner. And thus, there'll be less infertility in the world and larger, happier families. So I encourage you to speak to a reproductive endocrinologist about your concerns, your desire for family, and figure out when IVF is the right time for you.